So what we want to know is, in implementing the law, what else, what are the steps what are the budgetary requirements do we need? And how do we, what is the vision in fully implementing the law? Now, for example, how much do we need for the ILRCs? No, how much do we need for the multidisciplinary roadmap? In the same time, it will be a signal to CHED to promote different courses that will help form the multidisciplinary team, also come up with courses for our special need teachers. So it's all interconnected. So the roadmap is, we envision the roadmap as the Bible for the implementation of this law. So without that Bible, we cannot move forward and have definite targets. So that's the complication of not having that roadmap. Nevertheless, I have some more questions, but I want to hear from our stakeholders here, their comments on the implementation of the law. Ito lang ba may highlight? Okay, because some of our departments and offices who are here have specific responsibilities in the law. So we want to start off with DSWD. Any comments? Because we also included in the law some responsibilities, no? So, for the implementation of this, of inclusive education. So any comments?
Good morning, Mr. Chair. The DSWD reaffirms its strong support for the implementation of the RA 11650, also known as the Inclusive Education Act for Learners with Disabilities. And one of the role of the DSWD, as indicated in the Act, is the one of which is the provision of social and welfare services for children with disabilities. And the DSWD would like to share the continued efforts to address the needs of children with disabilities through the new project of the DSWD, which is the Cherish Project, Mr. Chair. The target beneficiary of this is the children with disabilities. It is a 12-month initiative running from July 2024 to June 2025, aimed at providing comprehensive social protection for children with disabilities and their families. It targets approximately 89,261 children identified as having disabilities from poor households. The project seeks to enhance and detect the registration of of children with disabilities through interagency collaboration, provide a monthly disability allowance of 2,000 to assist families with additional cost, and improve access to essential services such as healthcare, education, and livelihood opportunities. Additionally, this project also focuses on training community volunteers to develop effective home care support and services. That's all, Mr. Chair. Thank you.
Do we have any, I know that we have a lot of ayudas, no? Parang lahat na yatang pwedeng ayuda, meron na tayong ayuda. Meron ba tayong any support from the SWD to our learners with disabilities, particularly low income or our coming from poor families, LWDs coming from poor families? Do we have a specific program for them?
That would be the Project Cherish, Mr. Chair. That is for the children with disabilities po. And it's currently on the pilot implementation, Mr. Chair. That is the pilot regions are Puerto Princesa, City of Palawan, San Jose de Buenavista, Antique, and the Santa Cruz of Davao del Sur
So
po.
meron tayo.
Yes
Oh, good.
po.
That's good.
That is the first, Mr. Chair.
Okay, and how do you dispense the support? Do you go through DepEd? What's the mechanism to dispense the support? And is it in the form of cash or in the form of
Yes, Mr. Chair. It's a
okay.
2,000 monthly disability allowance po.
Okay,
Yes
okay.
po.
These are for learners with disability or
For
persons with
children with
okay,
disabilities,
okay.
Mr. Chair.
Okay. So how do you dispense that? How do you give the support?
The data, Mr. Chair, will be based on the PRPWD of the DOH, Philippine Registry of Persons with Disabilities po.
Okay.
In coordination with the LGU po, Mr. Chair.
Okay. Okay. And how do you give the support? Do you have people, do you go to the schools, or how do you give the support to the LWDs? Do you know?
Actually, Mr. Chair, it's a different bureau who conducted the pilot implementation. But let me check. Let me check, Mr. Chair.
But that's okay. If later
Let me
on,
check on that.
yeah, later on when DepEd calls for the interagency coordinating
Yes,
council,
Mr.
of
Chair.
which DSWD is a co-chair, um, let's integrate that support to
Yes.
this law, no?
Yes,
So
Mr.
that
Chair.
it will be harmonious.
Yes
Meaning,
po.
for example, those LWDs who are going to our public schools, let's make sure that they are targeted and
Yes.
given support,
Yes
because
po.
obviously when our learners with disabilities go to school, they have to buy uniform, they
Yes,
have to
Mr. Chair.
buy
Yes.
books, they have to pay for their special support services. No, yung pamasahe lang is already an expense. So let's my message is, let's work with the coordinating council, because that's the whole point, no? So that the students, LWDs going to our school system, are given support by other agencies other than DepEd. Kasi admittedly, may mga gastos sila eh. No? Yep.
That is
But I'm
noted,
happy
Mr.
to hear that you have Project Cherish
Yes, Mr. Chair.
that is being implemented right now.
Yes,
Okay.
pilot. Sa pilot regions po.
Okay. And when do you plan that to go nationwide?
Well, after the pilot implementation, Mr. Chair, we'll have a monitoring evaluation, and if this project will be successful, Mr. Chair, this will be conducted po on a national level.
Okay. Thank you for that. Next is the DPWH, and there's also a specific role in the law given to DPWH, in particular the infrastructure support to LWD. So, any comments?
Good morning, everyone. Good morning, Mr. Chair. For the DPWH, as of now, we are on the process of the conduct of audit for the school buildings, and the district engineering offices is submitting the compliant of school buildings po.
Meron na bang nag-umpisa na yung audit?
Yes po.
But we're talking about almost 47,000 schools. So, meaning your engineering districts will conduct audit on all of these schools?
Yes po. The district engineering office is the one who conducted the compliance of the school buildings.
Have you started the audit of the schools? For example, ramps, railings. Have you conducted those?
Yes po.
Meron na? Do you have
Yes
any?
po.
Do you have a report?
As of now, we are still awaiting for the submission of the district engineering office.
Sige, can you?
Maybe this year, end of this year.
Yeah, it's good to hear that you have started the audit, and just submit to the coordinating council and also to this committee a copy of that audit, so we can help you with budgeting. We can also help DPWH in pushing for those infrastructure requirements for learners with disabilities.
Yes, Mr. Chair.
Thank you for that. Next will be DOH. Any, any,
Good morning.
yeah, go ahead, ma'am.
Good morning, Mr. Chair. The Department of Health fully support this RA
Oo nga. Yeah, yung
11650.
next bill.
As of today, sir, we are coming from four offices, sir, which is we are all part in the RA 11650. Just to name is one is the disability program, one is the oral health program from our health Promotion Bureau, and also a touch agency from the National Nutrition Council. Please allow us, sir, to share with you
Yes, go ahead, ma'am.
per officer, sir. Um, the passage of RA 11223, also known the Universal Health Care Act, further guarantees that all individuals, including those with disabilities, have access to quality health services without financial hardship. The Act's provision aligned with the eight-point agenda as the health sector's medium-term strategy to achieve universal health coverage, improve health outcomes, and strengthen health systems. Recognizing the growing concerns of persons with disabilities, various laws and policies have been developed to enhance the quality of life for these individuals. RA 7277, or the Magna Carta for Persons with Disabilities, provides rights and privileges for persons with disabilities, promoting their integration into mainstream. Further, supporting this RA 7277, the Department of Health issued an order, the revised national policy on strengthening the health and wellness program for persons with disabilities, which aims to establish an effective national health program for this group. So the implementation also, as mentioned earlier, the implementation of the Philippine Registry for Persons with Disabilities was developed in collaboration with the National Council on Disability Affairs Office that further strengthens these efforts by systematically identifying and supporting individuals with disabilities. The PRPWD is a registration system where data such as general information, types, and causes of disabilities are captured. And aside from being a registry, the system also designed to assign a unique identification number for persons with disabilities to enable them to avail of discounts and other benefits. As of now, Mr. Chair, as of November 9, encoded or registered in the Philippine Registry for Persons with Disabilities, the total of 1.8 million person with disabilities, including already po children with disabilities, sir. And learners with disabilities can avail of services for person with disabilities by applying for a person with disability identification card. Hence, learners with disabilities are encouraged to apply for a person with disability ID card, provided that they can submit the required documents to be recognized and receive services provided for persons with disabilities. As of now, we have 10 categories or 10 types of disabilities registered in the system po. Currently po, the Department of Health is also enhancing the type of disability by developing a standardized definition and categorization of disability in the Philippines. So at this time, we will have 9 categories of disabilities, namely hearing disability, intellectual, learning, mental, physical, speech, language, and communication disability, visual disability, cancer, and rare diseases. So the objective of these guidelines is to generate disability definition that will be understood by all stakeholders and utilized in assessing and providing health and rehabilitation services for persons with disabilities at all levels of healthcare in the Philippines. The DOH also planned to develop a manual of operation and training modules for this categorization of disabilities by next year to ensure the timely quality assessment and categorization at all levels of care in the country. Moreover, the DOH implements the Magna Carta for disabled persons with disabilities to provide a 20% discount and value-added tax exemption upon purchasing health-related products such as medicines and medical devices and the availability of health services. And lastly, to ensure financial risk protection, the Philippine Health Insurance Corporation provides health benefits and rehabilitation packages for persons with disabilities, specifically for children with disabilities. This includes the rehabilitation packages for those with hearing, visual, mobility impairment, and developmental disability. So, Mr. Chair, can you also share with other programs that are present here to share also their initiatives from the Department of Health?
Yeah, go ahead.
Thank you.
Go ahead. Who's?
Good morning, Mr. Chair. Good morning, everyone. For Health Promotion Bureau, sir, we have incorporated in our implementation of the Healthy Learning Institutions program some aspects of ILRC. So HLIs or Healthy Learning Institutions, it's mandated by the Universal Healthcare Act. It's a program, it's a multisectoral program aimed at promoting the health and well-being of both learners and school health personnel. And since our pilot implementation in 2022, sir, and 2023, and our implementation this year's current year, we have incorporated, sir, indicators on on ILRC. So what we do, sir, is we provide materials to elementary schools and that are related to ILRC, including inclusivity and well-being materials for schools. And we also have our regional offices helping us in implementing HLI program together with ILRC, sir. So as of this year, sir, we have a total of 1,500 elementary schools that are within the program. And in implementing our initiatives, sir, in these schools, we have already incorporated ILRC indicators, sir. Over. Thank you.
Thank you. Thank you for that. Any, go ahead.
Yes, hello.